Hello, everyone. Welcome to DiCarmel International, here from New York, extending our service across the globe to the land of Australia. Thanks, everyone, for joining this session from wherever you are to make this day a very promising day for your career growth. And here I have a team of experts. That's Amy Prince from Australia, Brisbane, and that is Neethu Devadas from Adelaide, Australia, and I myself, Anil Josh from DiCarmel International, New York. Welcome everyone once again for joining this session for a lot of information that you will need to expand your career and to get into your dream destination sooner than later. So let's have a brief introduction, each of us. Amy John Prince, do you want to start from your end?
Thank you, Anil. Hello,
welcome.
everyone, and welcome to our live meeting. My name is Amy John Prince. You can call me Amy, and I'm thrilled to be here with you today, just to help you with your NCLEX and the OSCE exam, which is going to be the crucial steps for the overseas trained nurses looking to practice here in Australia. So basically, I'm from Brisbane, and which is basically in Queensland. It is the southeast of Australia with some subtropical weather that you always would like. So I bring a wealth of experience to our session today. Basically, I'm a nurse and a midwife with an extensive experience in both Ireland and Australia. I have worked in various settings, including the emergency department, as in the maternity. Also, I have owned my clinical skills, and also I have a strong background in education, which I'm just doing now. At the moment, I'm just teaching in the university as a senior lecturer in University of Sunshine Coast and Australian Catholic University, where I'm just teaching the students in the classroom, in the labs, also conducting the OSCE examinations for the nursing students. And in 2018, I successfully passed my NCLEX exam. So I understand the challenges and pressures that you may be facing. So my goal today is to share my knowledge and experience, which may help you to feel confident and prepare you for the examinations. So yeah, thank you for joining, and yeah, let's start it.
Thank you so much, Amy, for your wonderful introduction. And Neethu, it's your turn now.
Yes. Hi all, I'm Captain Neethu Devadas. I am working here as a perioperative nurse in Adelaide, South Australia. I have experience in obstetrics and gynecological nursing. I hold a postgraduate degree from a Government Medical College, Calicut. And also, I have a postgraduate diploma in hospital management. And my academic credentials are further boosted by graduate certificate in nursing education and diploma in training designs. I have experience as a nurse educator, and I served Indian Army for 5 years. And there I delivered critical nursing care and management in challenging environment. Then I worked in JIPMER. This is a prestigious central government institution in South India. From there, I was trained in perioperative nursing. Then I used to give training for nursing nurses in language proficiency tests like PTE and OET. Then I got registered in Australia 1 year back. So recently I have given my OSCE exams and NCLEX RN exam. So through the experience, through that experience, definitely I will be able to help you in guiding how to successfully go through this exams in NCLEX RN and OSCE. So looking forward to the discussions today.
Thank you so much, Neethu. And now I think it's my responsibility to tell who I am, for those who don't know who I am. All right, I'm Anil George. I did graduate from Government College of Nursing, Medical College, Kottayam, 1998. And ever since I graduated, yeah, it's almost now 26 years. I've been in teaching, probably my 80% of my life was in teaching since graduation. And even though I worked as an RN myself in various roles, and I migrated to US in the year 2004. After clearing all these exams myself, I did my CGFNS in 2000. We had to fly all the way to Bangkok at that time to take the CGFNS exam, then clear all the language, everything, and then moved to US in 2004. And since I did my CGFNS in 2000, I've been involved with the NCLEX training. And it's my 24 years experience in NCLEX field. The reason why probably DiCarmel offers the best pass grade in NCLEX, because I know exactly what this exam is. I can guide everyone, while others may get challenged with other programs that you may get challenged to get to the exam in the second and third time. Here in DiCarmel, we'll try our level best to get you through this exam in the very first attempt itself. That's what we try to do, and so that you can meet your targeted day to get into wherever you want to be, utilizing all the opportunities that are coming up. So that's where I'm here to help you with my expertise in the field for the last 24 years. And also, it could be benefited from my master's program in nursing education from the US. And with my years of experience every single day, when I work with my students, I'm learning exactly what NCLEX is, how we can make it better every single day to have the best pass rate. And also, in the last couple of years ago, I added documentation services also into NCLEX program I offer. So it's a one-stop solution for everything here. So we offer not only NCLEX review, we get to the transparent, the quality documentation service. You will know exactly what you're going to do with the DiCarmel when you get started until you get your target or until you fulfill your process everything. So that's what DiCarmel will do with you. And that expertise and experience now we're going to also extend into Australia with the help of two experts here, Amy and Neethu, is going to make it a wonderful combination for you to approach for any of your NCLEX needs, whether it's for USA, Canada, or Australia. The same NCLEX exam for all these three countries. Hope everybody's knowing who we are by this time. And we're going to see what we're going to do today to get you understand the whole NCLEX process, and also into the OSCE and into the ANMAT. All those things you're going to see in more detail with the help of our explanation for each of us. And let's get started on. I'm going to share some screen with you here to show how you can understand this major complex process. We'll make it as easy as for you to understand here. All right, and all right, hope everyone can see my screen right. Just bear with me as I'm opening the right screen here. All right, okay. Can everyone see my screen by this time? If not, give a few seconds. It's our technological limitations, right? Okay, it's coming up, almost there. There we go. Yeah, I can see that on my screen. Right. Let me expand it a bit more. Okay, so I'm going to get you an outline of what we're going to do today. So yes, you all know who we are by this time. And by the way, thanks everyone for joining the session. And whomever joined late, yes, we just got started a couple of minutes ago. Probably you did not miss anything. And we'll try to keep you engaged for the next 1 hour of course. Maybe now another hour, 20 minutes. That's what our session will be. And what we're going to go over in this session will be, I'll be going over briefly about the USA RN opportunities and the whole licensing process. And also, then Amy will be going over the background of AFRA, the whole complex Australian. Okay, let me see. Can you see my screen? I hope you can. Yeah, there we go. Yeah, once more. Yeah, so I'll be going over the whole US RN opportunities and the RN licensing process. And then Amy will go over the background of AFRA and the opportunities as well as the eligibility and the requirements, followed by the registration process and also a lot of challenges that could be there in the process. And Neethu, with her recent first-hand experience clearing OSCE and being registered in Australia very recently, she'll be going over more about the OSCE. And then Amy will take the mic back and she'll go over the whole ANMAP assessment. For those who don't know what it is, you're going to hear that soon, shortly. And also the visa options. And you'll have another 20 minutes of time left towards the end to discuss any questions you may have and clarify our concerns, anything related to NCLEX and OSCE for US, Australia, and also be touching base a little bit about with the Canada as well as needed, based on your questions. All right, so everyone, let's have your questions keep ready as the session progresses. So you will have clarification of your questions by end of the session. So let's get started here. All right, so as I mentioned, I'm going to go over a bit about the US process and the opportunities altogether. And just bear with me for a second. All right, yeah, so I believe while opportunities are coming up everywhere, right? Nurses want to go into all countries. Our dream destinations are still limited. And if given a choice, I would say most of you might think about USA, if I'm not wrong, right? USA is a dream destination for anyone. People go to UK, they go to Ireland, they go to Middle East, or they go to Australia. Even from there, sometimes, not always, they want to still move to the USA, right? Everyone have some sort of dream, right? Inborn dream to be in the US. Well, okay, it's interesting. It's fascinating. And yeah, it's different, but each countries are different. But at the same time, it is truly a dream destination. It's a land that gives you a lot of opportunities for your growth, your career growth, and at the same time, also with the beautiful earning potential, and also I think what is special about US, I believe most of you know by this time, there are 50 different states within the US, right? There are 50 different states comparing to 9 provinces in Canada, or I believe around 9 or 10 states in or provinces in Australia. US has 50 states. So as it has a 50 states, so as it's diverse, how diverse the country, the land is. And so those who want to be enjoying the cold weather, you stay here in New York or in Illinois or towards the north, or you want warmer weather, you move towards the south, to Florida or Texas, etc. Okay, so that's how it could be based on your choice. So it gives a lot of opportunity, diverse opportunity for you to grow in your career and to your dream choice. You want to be in a particular weather, in a particular place, you want to be in a family within a state, you can be there as well. So based on your choice. And also, why this demand is so rising? Now, based on statistics, it clearly shows the aging population. I think it's a universal phenomenon. The aging population is increasing all over the world, and particularly with the increase in life expectancy in the developed countries, definitely in the US and all these countries, the life expectancy is increasing into 80s and 90s. So naturally, that increases the need for more people to care for the elderly people, right? More elderly means more chronic disease, right? Everyone, with diabetes and hypertension, all this chronic illness increases. So as the disability increases with aging, so to care for all these people, we need a lot more people to care them. That's why the opportunities are increasing. Now, while the opportunities are there when it comes to the US, it is true, it's a challenge. There are challenges when it comes to immigration. It's not that nice and smooth as you may be able to go to some other countries. It has its own strict immigration rules, but it's for a purpose. But those who are fully qualified can still make use of these opportunities to come to the US, provided you go through the correct process, the correct pathway. And it is that path I'm going to explain to you briefly at this time. So now I'm going to show you my screen here. Here we go. Hope you can see what I'm going to go over with you. Okay, so all right. So what I'm showing you here is a whole steps involved in the complex licensure process. Okay, hope you can see my screen. So yeah, again, it's a complex process, one of the most complex application process I can say. And people have so much confusion about this process. And the doubt could be, okay, which state I go by? What is CGFNS? What is ERES? I mean, which one I should choose? Or which state I should choose? You have all these doubts when it comes to NCLEX RN. But first of all, in DiCarmel, what we do, we want to give you the most transparent information. We want to guide in the absolute correct path. You'll be informed about what you had to do right from the beginning, so you won't be misled. You'll be getting the correct information so that you will be in your targeted dreams. At the earliest. That's what we are trying to do, without any confusion in between, without wasting any much of your time or money in that process. So that's why we have this very complex process made into a simple process and a transparent process, and it'll be all informed to you right from the beginning. And this is what we do when we do this application process. We get you all your complex, the long list of documents we need. We'll let you know what those documents are. And the very first part in the CGFN, in the application process, is the CGFNS application, which costs $485. Now, as I mentioned just before, some of you may think, okay, so why always CGFNS? Why not ERS? You may have heard ERS. The problem, if you go for, okay, I'm saying ERS. Some of you are not familiar with what ERS is. So that's another parallel service that will do your evaluation as well. But for the EUS, if you're looking for green card or for an employment-based visa, whether it's H-1B or green card, through your independent effort, then you should ideally go through CGFN's evaluation, not ERS, because it is the same agency, CGFNS, which will get you your visa screen to the end of the process. When you're ready to come here or when you get a job offer, that's also done by the same agency, CGFNS. If you go through ERS, later you had to go through the same challenge of repeating the whole process, going to college, nursing council, all those things will be unnecessary. That can waste your time and money, and you'll be discouraged at that point. Why you had to do all these things. Okay? That's why we suggest you always to go through CGFNS right from the beginning. Now, also, you may have a doubt. So which state board to choose? Again, I mentioned there are 50 different states, but not all the states you can write the exam comfortably from out of the US, because you need to have a social security number, a particular number you need to have, which you cannot get until you're physically here in the country. And that's why there are only a few states that ideally will be ideal for you, and those best states would be the best one is Illinois, and then Texas. These are the best one. And why? If it's Illinois, you can keep writing the exam. And in case if you miss it one time, you can write the exam every 45 days up to 3 years. Now, Texas is a good option if you're a really confident candidate. With the Texas, okay, but the problem, it only limits you to do only 3 attempts of exam. So you can write the exam only 3 times. If you don't get through the 3rd attempt, then you have to go through some state mandated program, which can be discouraging, more time consuming, and can cost you more money. That's why the ideal one for an average regular candidate would be Illinois. If you're someone confident, definitely go for Texas board. Now, at this time, I want to particularly state that it's better to avoid Florida Board of Nursing. And the reason a lot of people want to be in Florida, it's a very fascinating place, right? So it's a very tropical weather, it's warm, nice throughout it's sunny throughout the year, a lot of beautiful beaches, true. But the problem, when you apply for Florida Board from outside the US, you won't get an actual license. What you get will be like a score. You'll pass the exam, you'll get an endless score, but you cannot really transfer the score easily to another state. You don't have a license yet, probably yet. So that's why you should yes, I mean, it's not impossible. We do here, DiCarmel also assist you in the process. We can assist you in transferring your score, but it's a bit more complex than you're transferring your license, which is called endorsement. So therefore, the best one I suggest is the Illinois Board of Nursing. And yes, again, we start with the CGFNS application process. We apply with the State Board of Nursing, and its costs vary from state to state. For example, for Illinois Board of Nursing, it costs $107, and for Texas Board, it costs $75. Slight variations. So, and then we have to do fingerprinting, which the cost will vary based on the state. Now, at this time, I want to say, some of you say, oh, no, I want to be in New York. Well, if you have a family who is fighting for you to be here in the US and to New York, absolutely, no problem. That's the right thing for you to choose New York board. Otherwise, I do not suggest New York board. And the reason is New York has a very different process, and that process is called a credential verification service. While all other states go by credential evaluation service, CES, New York board, they go by credential verification service. So once you have done the CVS for New York, in the future, you're getting an opportunity eligibility, or you have written the exam for New York board, or you want to go for Illinois or for Texas or for Florida, then you had to go through an extended process. You'll be wasting more money and time there. So it's better if you don't have a particular reason to be in New York, you choose Illinois board or Texas board. That will save you time and money in the future when you have to transfer your license or endorse it to another state. And so, yeah, again, these are the three processes. The initial process involved: apply with the CGFNS, apply with the State Board of Nursing, and the fingerprinting. And this process takes on an average 3 to 4 months. Sometimes it's fast. I have had people gotten the approval in 1 month just recently. Based on which country, which state board you're coming from, sometimes it could be fast, sometimes it may take a little bit more longer. And once we have all these things done in 3 to 4 months, on an average, that's when we apply for ATT with the Pearson and pay the $200 fee. And usually get approved in a couple of days. And once you get the approval, that's when you schedule for the test. And to schedule the test, if you are in the US, you don't have to pay anything separate. But if you are outside the US, then you had to pay this $150 plus tax. So, and you pay the fees and you are ready to take your test date now. Now, with the Illinois board, which I mentioned, the most popular one, that gets you 6 months of validity for ATT. So it means once you get the ATT, you can take the test in 6 months' time based on your comfort, based on your preparedness. Because again, what we suggest, don't go and waste your money and time. Go when you're truly ready, even though it's ready, even though it's delayed by a month or so. When you're ready, go for it. That's what I suggest. And if it's a Texas board, then there is a little bit problem. Texas board only allow you to have 75 days of validity. That means if you're not ready, if you already have your ATT, you'll be under pressure to apply and appear for the exam, putting you at extra risk. So don't, again, go with the correct guidance. That's a point which DiCarmel will offer you from beginning till end. So you won't get disappointed and discouraged in between. And then people always ask, okay, so, well, we are done with the exam. We passed the exam. Great, congratulations. Okay, you passed. We are after that phase. Now, where comes the language? People have so much confusion when it comes to the language part. As I noticed, I mean, they ask me, I'm just going to change my screen. You can get my full attention probably at this time. Okay, so what I'm trying to say here is, people have so much confusion when it comes to the language part. And the confusion, okay, should I write the language exam right at the beginning? And is it mandatory for me to have the language to take the NCLEX exam? These are the doubts you may have. But the truth is, the requirement of the language is not for you to write the NCLEX exam. Well, that applies to some states, but the purpose of the language is not for writing the NCLEX exam itself. Rather, it is for the last step in the process, which is the visa screen. It's for the visa screen. You need to have your language exam cleared. Yeah, you need to have your language cleared for the visa screen purpose. So that means you don't have to go with the language exam at the beginning. Now, some of you may ask me, oh yeah, I heard for Florida Board of Nursing, they accept OET, or Colorado, a couple of boards, they accept OET. What about that? Well, that is, okay, some states have language requirement as well. When you write the exam initially with those particular Board of Nursing, yeah, that included for Florida Board of Nursing or New Jersey, etc. They need to have your language also cleared if you're writing the exam in that particular Board of Nursing to get licensed. But if you're endorsing to that state, you don't need that. Okay, so again, the requirement for language vary from state to state. So for New York board, for Texas board, or for Illinois board, you don't need your language exam written before the exam. For everyone who's coming here through an independent employment-based green card or H-1B, you may have to clear language as well. The purpose of the language is for you to get your visa screen done, again, which is the last phase in your goal achievement, the visa screen, the one which costs $740. Now, for this purpose, there are 7 languages that are accepted. While we heard OET is accepted for Florida, so there are 7 languages that are accepted in the US for all the states for the visa screening purpose. And that's what this language list you can see right here on my next screen, as I'm going to show you. Here we go. Yeah, so you can see, yeah, there are 7 languages that are accepted for the purpose, which include Cambridge English test, TOEFL IBT, the interface test. They don't accept the home base. Yeah, it's only from the designated testing center. TOEIC probably may not have heard much. So test of English for international communication. And then I think the popular ones that everyone knows is IELTS, right? IELTS, and then Michigan English is probably not that popular for most people. OET and PSNP. So yeah, I would say the popular ones that people use are these: TOEFL, IELTS, OET, and PTE. And the good news, a lot of people struggle with their IELTS and OET. Now, PS and PT is a great option for those who are struggling with your language exam. That's an easy one to achieve. It is less expensive than, probably less than half the expense of OET exam, and maybe a bit more easy than the IELTS exam. That's why I think it's getting popular among most of the test takers. And I've seen most people achieving their test score in the first attempt itself when they go for PS and PTE. It's a totally computerized exam, so you can get your result the same day. So, you can make things faster when you go for PS and PTE. And so, yeah, that was the last process involved. Again, the purpose of this language, as I told you, is not to write the NCLEX exam, rather for visual screen. And again, I'm going to take you back to the previous page once more. The whole outline what we just went over. So the visual screen part we heard. Yeah, so visual screen, that's when we need the language. Once you have the visual screen, it is good for 5 years. That will keep you safe there for the next 5 years with your eligibility requirements. And I believe I did answer everything. Did I miss anything, Amy or Neethu, that I should say? Important? Did I? Okay. All right. If we have anything else, we definitely
No,
get
Anil,
chance.
that you have done actually a good job. Yeah, you explained that everything well. Yeah.
Thank you so much. Okay, thank you so much. And I remember one other thing I should say for sure. A lot of people have concern about the NCLEX exam itself, how easy the exam is. I think it's quite an important thing I should share with you. Now, this exam, NCLEX exam, is not an easy exam, but DiCarmel will make it a lot better than it can be otherwise. And I want to show you, just bear with me while I show you some of my other screen. And give me a second. All right, almost there. Okay, so I want to show you something here to get you an understanding of how easy NCLEX exam is. And bear with me while the screen is coming up. All right, okay, so yeah, you can see my screen almost there. Yeah, it takes a few seconds. All right, so there we go. Yeah, so what you can see right here is the NCLEX pass rate. And by the way, when I show you this information, I want to say NCLEX exam is the same exam, whether you go for USA, Australia, or Canada is the same exam. There's no difference. Sometimes people ask me, oh, if I write for this country or this board, is that if I choose this board, is that a bit more easy for me to pass? No, there is no such thing. Americans believe in fairness. They want everything in standardized. They don't go unfair. Oh yeah, Florida people, you pass easy. New York is hard. No, there is no such thing. This is the same exam, whether you go for New York board or Illinois board or Texas board or AFRA or Canada. It's the same one and same exam. There's no difference in this exam, and there won't be any better chance for you to pass whichever board you choose. That's one thing I want to say, because they all are conducted by NCSBN from the US. Whether it's for AFRA or for Canada Direct NCLEX, they all are conducted by NCSBN from the US, and there is no difference in the evaluation. Now, what I want to show you here, every 3 months, again, as I told you, everything is statistics based, and every 3 months, NCSBN release those test results and the pass rate of the candidates from USA, the primary country, because NCLEX started in the US here in practice since 1994, in my best recollection. And so, yeah, since the initiation of this, the current NGN-based test, the pass rate, first of all, has significantly increased, making NCLEX a bit more easy. Even then, it's not an easy exam. Now, it is easy for the US graduates. I just want to show you a couple of things. I do have a lot of information here. I don't want to show you the whole page. It's a lot of information, but I just want to point out a couple of things, if you can follow my pen. So yeah, you can see in the US graduates, among the US graduates, you can see the pass rate for the diploma nurses, it's 94, which is same as associate, what they call, and the bachelor's, well, pretty much the same, not different. You can see the pass rate of US graduates around 94%, because that's how they are prepared from day one of their exam. I mean, day one of the nursing school, that's how they are prepared. So they are well ready to take the exam soon after they graduate. 94% of them pass in the first attempt. Well, let's go into international. That could include anyone. So when it goes to international, you can see at the bottom, here we go. So first time international, the pass rate is 58 point, yeah, you can see from 94, it's coming down to 58, somewhere around. And for repeat takers, around 44. So that's the average pass rate what international candidates have. So while this is the average pass rate international candidates have, the pass rate with the DiCarmel is more than 95% in the first attempt. That's all it gets you prepared. So you don't lose your money and time when you go for the exam. You will know, I will be able to tell you where you stand, whether you're going to pass or fail. If you're going to fail, don't go. Don't waste your money. Particularly those who are listening to me from Middle East. Okay, you got to flight all the way to India paying so much of money, right, to take the exam. If you fail, what a waste of money and time, isn't it? Very discouraging. Let's avoid that by getting the right training. And why is it different? How is it different? Why DiCarmel is different or better when it comes to this passing? I mean, why do we say our pass rate is more than 95%? The reason is nothing but we give so much of intensive training. We have 24 live hours per week, scheduled in such a time that from anywhere from the world, you can attend the classes. You can attend the live classes. We have 8 sessions, morning and evening. From wherever you are, you might be able to attend those sessions. That's how classes scheduled. In addition, we also have a beautifully designed online library. So I'm going to show you that while I'm talking this to you. Just give me a second. I was not planning for this for you, but just bear with me for a second. I can even show you this information. Here we go. Yeah, so we do have a beautifully designed online library. In addition to the 24 hours live classes, we have an online library. Here we go. I believe you can see my screen almost there. Yeah, yes. So this library has, thank you. So this library has all the resources you need to pass your exam, and that include all the content available as video lessons. There are 91 videos covering the whole content, what you need to know to pass the exam, which has the content review as well as question and answer discussed in it. And also we have, very concise and beautifully designed notes and PowerPoints. We have nearly 15,000 PowerPoints, 12,000 to 15,000 PowerPoints. I can't even count them. There's too many. And somewhere around the number of PowerPoints we have, which will make your learning a lot more easy and understandable. Instead of, okay, another thing I want to say at this time, how does the DiCarmel have such a huge pass rate? Yeah, I told you the time we spend. Every day we spend nearly half the time doing questions. And also, I will help you to get your understanding deeper by going through the path of history. We don't believe in memorizing things. We don't believe in memorization tricks alone. We try to understand things as good as we can. So whatever way the questions come, you'll be able to handle them, and you'll be able to pass the exam in the very first attempt. That's what our goal is. Provided you listen to me and work with me, and that's when you get that high pass rate. I think I did cover everything what I want to go over. I don't know if I took a little bit extra time than I am supposed to. Sorry if I did that. Okay, I'm taking away the time from Amy and Neethu. They both have a lot to talk. And I think at this time, I'll definitely switch into our next speaker. Who has the next speaker? Amy, is that you? Okay. All right. So Amy, yeah, I'm kind of over the mic to Amy. She's going to talk all about the AFRA and yeah, AFRA, the ANMAC, all those things she's going to go over. Okay, and I'm getting her PowerPoints ready so she can show what she meant to show. Okay, Amy, mic is yours.
Thank you, Anil. Thank you for that's a wonderful session that you were giving everything related to the NCLEX and registration to US. I can see that there are so many comments out there. We are going to attend that at the end of the session. No questions are going to be unattended. We assure you that. So let me just take you to what I'm going to explain here about Australia. So let me start with the current statistics here. Then I'll just give you why you should think about moving to Australia. and the steps for that. So when we are just looking into the current statistics, I'll start with the registered nurses and the midwife, the number of the people, those who are here in Australia. So it is just roughly, according to the recent report, it is 480,070 registered nurses and the midwives are here in Australia. When we look into state-wise, the distribution, I could say that New South Wales have the highest number of nurses, whereas Victoria is coming as a second, which is 100,000. Queensland and Western Australia is coming after that. Least number of nurses we have here in Australia, that is at Northern Territory. I think that you have heard about Alice Springs, whereas a very limited number of nurses, that is 4,300 at the moment. When we are looking into the employment and the hours here, we have the option to work here as full-time, part-time, and we also have the casual basis. We can work here. When we tell about full-time, that is around 34.6 hours, technically 35 hours per week that people have to work if they are signed for a full-time worker, as a full-time worker. So we are entitled to have the annual leave. We have the personal carers leave, that is a 10 days of leave per year. Also parental leave, that is 18 weeks. For that, there are something like that you have to work with an employer for at least 12 months, that is 1 year. Also, you're entitled to take long service leave. So, for example, if you just finish the 10 years of your continuous service in the hospitals anywhere in Australia, you are entitled to take 8.67 weeks of your leave, that as a long service leave. Also, you have compassionate leave, that is like any reasons for that, that is included your pet. Also, community service leave, like if you are doing any jury duty or something, that you are entitled to take that as well. Other entitlements that I could say about public holidays. If you work on the public holidays, almost double the amount of salary per hour that you will get. Overtime is there, penalty rates are there. Also, to make sure that your work-life balance, you have so many other things like Fair Work Ombudsman, you have the union to make sure that everything that it is set for you in a balanced way. So let me just move to the slide that is regarding the reasons to move to Australia. This is based on my experience as well. I would say that experience will just make it perfect to convey the message to the audience like you people. So when I put myself in this position, the reason for me to move to Australia, before I could come here, I was in Ireland. I spent 5 years there. Then I moved to Australia. The reasons that I moved to Australia, first thing is immigration. So not like other countries, our immigration, it is not lengthy like other countries. There are pathways out there, like for getting the PR, especially for the nurses, skilled migrant visas are there. So many visa options are there. That is going to be dealt with Neethu later. So the second thing is the weather. Where I was before, it was really cold. But where I am now, thank God, I would say that it is really a good weather. So when I tell about the weather, it is from tropical in the north to the temperate in the south. So it is providing different living environments and which will suit for the diverse people or according to their preferences. Next is about the culture. So here, when we just look into the history of Australia, here we had the people, Aboriginal and Torres Strait Islander people. They were here before. And after that, we got many people moved into this country. So people from over 200 countries that we have at the moment here. So we have really a good diverse society with different traditions, respecting each other, keeping their culture. So I really love it. So amazing people that I'm around with. I really love the way that we have here at the moment. Other reasons that I could say, which I have not highlighted in the screen, main thing is about healthcare system. So here we have a mix of public and private health services. For example, when I say about the public health services, we have the free treatments in the public hospital. We have a Medicare system, like that Medicare card will cover the treatment and accommodation of the patients, those who are coming to the public hospital. So there is nothing out of pocket. There is not any there is no any difference in the treatment. Like if you're just coming to the hospital, if you are rich or poor or middle class or upper class or whatever, you will be treated same. It is not like your insurance basis or anything that to get the treatment. When you come, if you are, they will just assess you and they will take you for the further diagnosis or whatever that have to be done on you guys for the medical conditions. Another thing is that bulk billing system, what we have. So like other countries, there is no need to just to jump into the hospital for everything. We have the general practitioner system, like as America, we call it as doctor's office, where we call here as the GP, general practitioners. We can go there and everything is free. Like we have our every 3-month blood checkup and everything will be, the communication also is really good. They will send you that every information and say that how is your health, what are the diagnostic tests that you have to go according to the condition. For example, when you are reaching your age of 45, that you have, it is mandatory for you to go for the checkups, like, or the which is coming under the screening tests, like cancer screening, breast cancer, or the cervical cancer, or it is any prostate cancer, whatever, that they will send the letters to you and make sure that you have gone for, or you had your screening. So these all things are good. And also for specialist services, there are some contribution from the government. Also, medication pharmaceutical benefit schemes are there. For example, for 1 year, you have a threshold of this many amount, and you can just get the medications and everything within that particular amount what government has been set for you guys. So that is actually a really good thing that I would say about the healthcare system. Again, education. Education is free for the children. And when we are just looking about sending the kids to the university, comparing to the other countries, it is very, very, very less when we are comparing to other countries. So it is not like after the kids year 12, definitely we have to send for any university courses, like for any medicine or law or whatever. For one semester it is going to be only 10,000, and everything will grow in the backyard. So that is the main attraction of Australia, that I would say. Let me just move on to the next one, giving you a big number about the high demand of nursing professionals by 2026 here in Australian government, which is by the Job Outlook. As you can see here, it is 333,500 nurses. The government jobs are coming up in 2026. That when we are looking into why it is, the next slide is just showing you that what it is. Around, as I told you, 333,500. Out of that, 70,000 nurses are expected to require in the aged care sector alone. So that is a lot, or it is a huge number of nurses that we want here in Australia. So when we are just looking into the next thing about the findings, how this or why this demand of nurses here. So when we look into the demand of nurses, as it is 333,500 nurses that we need by 2026. So in that future projections, when we just look into that, aging population is just getting high at the moment. The reason is that after the World War, there was a Second World War, there was a booming of baby booming, like all the babies just born after when the soldiers came back after the war. So those people are coming to that age of 65, 70 in coming years. So the aging population has gone to 16% to 22%, and it is just increasing. And again, the healthcare spending amount, it is increased at the moment. That is to around 220 billion. When we just look into the technological integration, like after COVID, as you know, telehealth, everything is just getting more attention at the moment. So people, those who are outer areas, they don't want to come or travel. So giving all the facilities there through the telehealth. So telehealth nurses, that all area, it is getting famous at the moment. So it is 16 million at the moment. When we are looking into the rural and remote nursing, so they also increase of 12%. So when we put this all together, according to the findings, the recent findings from ABS and also Australian Institute of Health and Welfare, it is saying that we need more nurses. So now we know that why we should move here. We know that what are the attractive things here. We know that what are the demand for nurses here in Australia. So now we are going to see that what is APRA registration process. To work here or to get registration here, to work as a nurse in Australia, you need to go through the nursing registration process in Australia. That is the APRA registration. So the Australian APRA stands for the Australian Health Practitioner Regulation Agency, which is a national organization responsible for the regulation of health practitioners in Australia. So not only for the nurses, it is for the doctors, also for the physiotherapists, occupational therapists. So it's a group of health practitioners. They have to register under them. So this one is established in 2010 after I came here, Australia. And this APRA works in partnership with NMBA, that is the Nursing and Midwifery Board of Australia. So here, the main responsibility of APRA are registration of health practitioners, accreditation of them, the people those are working under there. They will look into any complaints or if there is any notifications or anything. Also, they have the nursing standards. That's everything based on the nursing standards. So they have the guidelines for each and every nurses to work. Basically, this is for improving the quality of nursing care, also for the public safety. So let me just explain about the steps, how that you have to do this, the APRA registration process. So as you can see here, there are mainly 4 steps. So one is first one is the step 1, that is the pay for international qualified nurses and midwives assessment fee, that is $410. Australian dollars. And step 2 is after this, you have an orientation part 1, then you have a portfolio, then you have the NCLEX examination. There you have to pay 200 USD. Then again, coming to the OSCE is the 5th step. There you have to pay 4,000 Australian dollar. Then you have to apply for the registration. That costs around 489 Australian dollar. Then orientation part 2. Let me just divide it and just make it a symbol for you guys to go with the steps. So when I explain again about the steps, the first one is the self-check. So before anything, that you can, the self-assessment or self-check is there, because this is based on an outcome-based assessment. There are many steps. The first one is the self-check. So you can create an account in the APRA site itself, and you have to pay the fees. So you have to go with different steps. There are stream A, B, C. We are here to help you with that. So they are basically just checking that whether you are eligible to attend or you will eligible to register for this APRA registration. So once you have submitted everything for the self-check, they will they will give you along with that soon after that you have to do the orientation as well. So in the orientation phase 1, there is a video of 90 minutes. So at the end of that, you have to do a MCQ question. Like, it is not really hard, you can do it. So then you will make the portfolio as well. So once self-check, orientation phase, then you will give the you will make that every information there and the portfolio. Once that all done, they will send you the ATT. ATT is the card for you to write your NCLEX examination. It's the same thing what Anil has discussed before about USA. So once you receive this ATT or the authorization to test, within 90 days that you have to take your NCLEX. For NCLEX, that you need your NCLEX preparation. So once you have done your NCLEX examination, then that will be sent to APRA. The result will send to APRA, and you will be just advised that you can go with the OSCE examination. So where OSCE is the one that is Neethu is going to explain more in detail about that. That is a simulation-based one. It is there are 2 centers at the moment here in Australia. When we started here in Australia, we had only one examination center that was in at University of Adelaide. But now that we have opened another one in Melbourne, and later it is going to open in other states as well. Once you have done the OSCE examination, we will just go to the next step, that is about the English examination. So there you need, after you finish your NCLEX and your OSCE, you need your English. So NCLEX examination, you can just write it online, you can do it, but for the OSCE, that you need to come here in Australia to do your OSCE examination. So the main questions that will come around when you have to give the English examination. So after this too, or if you're doing it before also, there is no harm. But when you finish your NCLEX and your RN and your OSCE, that you can do your English examination, and with that result that you have to send that everything to APRA for your registration. They will assess it, they will verify everything, then they will tell you about the notification of outcome. If you submit everything on time, actually it is not going to take much time. It is a smooth process. And as you know, Australia, it is based on verification. So they will do everything, just go back and double check. From where you studied and where the papers sent from the country where you are, if the people from there, if they are very good in responding to the queries and everything from APRA, things will be really easy. So it will move fast. But if there is any lag, you know that according to that. But you can go into the APRA site and check that the status of your process. So once you've done that notification of assessment, you will move to the next step, that is the orientation part. So orientation part, that is there also that you have to do some work, and then you will be getting that your outcome of that. There is the registration. So next one is about ANMAC. ANMAC is another one thing that is about the skill assessment. It is the modified skill assessment. So that is for your visa process that you need. So modified skill assessment, here also the steps are there. The first one is that you have to create an account with the ANMAC. Then you have, there is documents that you have to submit. There are some documents like your experience and so many documents that all should be attested. There are some informations that who can attest it, how you can do it, what are the types of the files that they will be accepted in the ANMAC during the ANMAC assessment. So that all things will be that you have to follow through. Then language proficiency. They will look into that language proficiency certificate. Then you can do the online application payment. Next one is the document verification, that they will do that everywhere. Then they will do the assessment process. Then they will notify you the outcome. So that is about the ANMAC assessment process. So when we are looking into the English language proficiency test, this is the main question that will come from many students that or the candidates, that what are the English language proficiency testers that is accepted in Australia. So as you can see here, a ELTS, that is the academic one, that is not the general one. So minimum score of 7 in each of the 4 components is needed. So that is a listening, reading, writing, and speaking. So overall band score of at least 7 it is needed for you to submit your papers or the English language proficiency test. So the other one is OET. So OET, it is a minimum score of B in each of 4 components. That is the listening, reading, writing, and the speaking. Third test which is accepted here is the TOEFL. So here that as you know, the listening is 24 and reading is 24, writing is 27, and the speaking is 23. So these are the minimum scores that they are looking for you to do before you could apply for your registration and your NMAC. The next one is PTE. So that also accepted here, the minimum score of 65 in each of the 4 components. It is that the candidate should get to consider as an English proficient. So these are the main things that you have to think about. So it is about how to do the prior registration and ANMAC assessment, and about the English language proficiency test that it is accepted here in Australia. So that's all about that prior registration that I can explain, but we are open for any questions towards the end of the session. If you have any questions, throw that questions in the your comments, and we will discuss that towards the end.
Thank you so much.
So now I would like to request Neethu to give her valuable information regarding the OSCE.
Thank you so much, Amy. And Neethu, sorry, Neethu. Before you proceed, I got a bunch of questions. Let me just briefly go over them, and then I'll turn it to you, okay? Just want to answer a few questions I have. So we have question and answer session to the end also. A couple of questions I'm just going to go over briefly. Someone asked if PTE is accepted for USA. Yes, it is. As I mentioned earlier, there are 7 languages that are accepted for the US. I have shown you the list. Yeah, there are 7 languages. The most popular ones are OET, IELTS, TOEFL, and PTE. PTE is a great option. A lot of people get to that in the very first attempt, and it's comparatively inexpensive. And the other question I got from you, the group, is visa screen. Yeah, visa screen validity. Once you have the visa screen for US, yeah, that's for the US, you'll have 5 years of validity with that. You won't have to worry about your qualification part until then. Another important question I got from a bunch of you, okay, I have my US license. Now I want to move to Australia. I want to try Australia, and vice versa. I got from both of you. So the answer is, yeah, here DiCarmel can assist you in transferring your license from Australia to USA, or US to Australia, or to Canada. Yes, we have an expert service from here that will help you meet all your needs, whatever it would be. All right. And have more answer to your questions coming up later. And yes, Neethu, yes, please take over and explain all about your OSCE now.
Yes, thank you, sir. So OSCE is an objective structured clinical examination, which is an integral part of APRA's OBA process. So this is a mandatory step, and it is a very challenging exam. And at the start, when they have started this OBA program in 2020 March, so in the beginning, the success rate for OSCE exams were below 30%. And in 2023, the success rate for OSCE exam is above 80%. So in the beginning stage, nobody was knowing what are the anything about the exam, and there were less training centers that time. Now the passing rate has increased. That shows that with the proper training and guidance, you will be able to clear the exam in an easy way. The significance is lies on the proper training. Okay, so the OSCE exam mainly assess your clinical communication skills and the clinical skills, the proficiency in doing basic nursing skills, so that the APRA want to assess whether you will be able to adapt to the demands of Australian healthcare system. So first, we will see what are the major changes when we compare Australian nursing care to our country. So the first one is the nursing education in Australia emphasize on evidence-based practice, critical thinking, and guidelines of Australian Commission on Safety and Quality in Healthcare. Since their education is mainly focusing on these things, evidence-based practice, critical thinking, and the safety and quality in healthcare, while they assess the international nurses through the OSCE exam, definitely they are going to look for this critical thinking skills and evidence-based practice in Europe. Then, autonomy and managing patient care independently. Back home, rather following physician's order and providing the bedside care, here what happens, nurses are more independent. A nurse practitioner is authorized to prescribe medication, and some of the registered nurses can order for some of the investigations, and they can independently plan nursing care. So that extends that level of autonomy is expected in your practice here. Okay, the third one is collaborative multidisciplinary team environment. In the hospitals in Australia, we can see a collaborative multidisciplinary team environment. So to be a part of this multidisciplinary team environment, you need a good communication skill. Then only you will be able to share the information regarding the assessment of the patient, your evaluation, and your critically analyzed things about your patient, so that a multidisciplinary level care can be provided to the patient. So definitely APRA will be assessing your clinical communication skills through OSCE exam. Next is practice guided by strong ethical framework and patient-centered approach. So the ethical principles like malfeasance, then respect for patient privacy and their autonomy is the integral part of nursing in Australia. So before doing any procedure, you are expected to seek an informed consent, provide privacy, and respect their choice of treatment or the decision. So that is a little bit different from what we are practiced with, isn't it? So these are the main things, major difference which we can identify when we compare the care in Australian nursing practice and the Indian context. Next, we will see what are the challenges we have to face during the OSCE exam. OSCE exam is a comprehensive assessment. Like I said, it assesses your clinical communication skill and the skill in doing basic nursing procedures and the assessment. So these skills are assessed in a set time. There is 10 minutes time for a station, in which 2 minutes is for reading the scenario and 8 minutes is for performing that particular skill. In that 8 minutes, you need to interact with the patient, identify his problem, plan the care, execute the care, and document it with the evaluation. So that much things are happening in these few minutes of time. So you should be prepared well enough to perform you should be well prepared to give this exam. Then the simulated real life scenarios. There will be the exam is conducted in a high fidelity labs, simulated labs, and there will be real patients with real healthcare scenarios. So you need to interact with these patients in a normal way and identify their problems and give them the needed care. So the simulated real life scenarios is a challenge because we are not versed with these kind of examination strategies back home. Then high standards and rigorous criteria. APRA expect for very proficient and efficient nurses to be the part of their healthcare team. So they are looking for highly efficient nurses. So the APRA is not giving any chances for errors. So you should be very thorough with the procedures and the protocols here when you give the exam. Then cultural and ethical considerations. Here in Australia, there is a card population that is culturally and linguistically diverse population. Their health demands and risks are very different. It is not like that we have practiced back home. So to provide them a culturally oriented care, you need to know more about their health demands and risk factors and how to deal them to provide a culturally safe care to them. So to understand these all things, understand these challenges are the integral part of giving an OSCE exam. I have given my OSCE exam around 1 year back. So I know what are the challenges as a candidate you will be facing. The examination day itself is a very stressful one, and we are spending almost $4,000 for giving this exam in one cycle. And if we are not able to make it in that the first attempt, it's a great loss, isn't it? So what I have to offer is that we have an expert team with Ms. Amy, Anil sir, and me. We will be able to guide you and train you in a proper way so that you will be confident to give the exam and with the proper time management and necessary information which you need to know to crack this exam. So this is about the OSCE exam, and if you want to know more about any OSCE exams, you can ask your queries in the comment section, and we will discuss once we get the time for the discussion.
That was amazing. Neethu, you made the OSCE simple while it's complex, as most exam takers say. You made it, and I think that the worst part is very expensive, right? It's 4,000.
Yes.
Yeah, to pay that much, to fly to Australia, pay that much, and then we don't want to miss it. No way, no. Right? I don't think anyone wants to go to that, right? Right.
Then to give this exam, the rest of the exam we can give it from India or any other countries. But to give the OSCE exam, we need to come to Australia, stay here and prepare for this exam. Then we are going to give the exam. So associated with this OSCE preparation and training, there is a lot of expenses are there. So it is a wise option is to approach a good training agency or the training institute for OSCE preparations. It's an important decision during this when you go through this OBA process.
Great. All right.
And in OSCE, I forgot to mention about the stations. We have 10 stations. Mainly the stations will be assessing your communication skill, basic nursing skills like vital signs assessment, giving medication, then the blood safety, all these giving CPR, all these skills are assessed. Then for every station we have 10 minutes, so the total exam will take 100 minutes, and 2 minutes is for reading the scenario and prepare yourself, and 8 minutes is for performing that particular skill in that particular station. So that's about the OSCE exam.
All right. Okay. So what's next?
Thank you, Neethu. There are a few questions. Yeah, let me answer that.
Sure.
Thank you, Lily, for the question that the first question that you asked, that do you give OSCE training? Of course, yeah, we will give the OSCE training the same way how it is just training the Australian nursing students, the same way that we are just, yeah, we have the lab, we will train in the same way. So hope that that's the answer that you are looking for. Now the next question is, how many months they have maternity leave? Yes, Lily. At the moment, of course, we had really a big, amount of weeks for as a paid leave for the maternity. But nowadays it's reduced to 18 weeks paid leave, so that you can. That's a fully paid leave. Okay, so you can just take the leave, and maternity leave and paternity leave also there. Okay, the father also can take the leave for the crisis moment of that first, when a new baby entered into the world and the family. So that is there. The other thing is that there are something like you have to keep in your mind. You should finish, you should be a full-time, sorry, not full-time, even full-time and part-time, that you are entitled to get the maternity leave. But for a full-time person, you should be with your employer for 12 months, then you will be eligible to take 18 weeks of your paid leave, fully paid. But half paid are there, like if you want half paid maternity leave means that you can double that, like 36 weeks of your half paid maternity leave that you can take. And there is not going to be any discrimination or anything if you ask for your maternity leave or anything. So that's the different thing. Do you provide services to endorse Australian NCLEX to US license? That question I will throw to Anil. Anil, that it is just a question to you, that do you provide services to endorse Australian NCLEX to US license?
Sure. Right time to answer, Amy?
Yeah, can you answer that?
Okay, thank you. Yes, I was talking about that. I mentioned that earlier briefly. Yeah, and I'll say that a little bit more now. Yes, we can transfer your license from Australia to US or from US to Australia. And yeah, we have the option to do either way. And when it comes to the US, again, it's when transferring from Australia to US, it'd be more challenging because not all states accept it. The easiest one, which we have figured out, yes, we are figuring out everything to get you served in the right way, because there are a lot of people who want to transfer to US and vice versa. Yes. So now we have an effective way to get your license transferred to Illinois Board of Nursing. And by the way, so in Australia, once you pass your NCLEX exam, what you have is your NCLEX score. You won't have your NCLEX license. You won't have the RN license until you get to the rest of the all for a process, which you won't have once you pass. But with your NCLEX score, we can transfer your score from Australia to Illinois and maybe to New York Board as well in the process on the way. And so same, we can do that back to Australia as well. Now, Texas, if you, there are people who want it for Texas. Texas is not unfortunately accepting the AFRA score at this time. Hopefully they will change their mind in the future. Yeah, but we can transfer either way.
Thank you, Anil.
You're
There is
welcome.
another one question that I have to answer. Simi, thanks for your question. That is about age limit on Australia. I know that this is a killing question that will be there in the mind of everyone. Of course, there are 45 years is for the main visa. That's the age limit it is given. But for the nurses, there are another one visa options are there. That is another one. It is 486, I believe. So that visa options are there, and you can. And again, since we are coming under the nursing skilled category, when we are calculating that everything, definitely there are options. I think that's a good answer that you are expecting, Simi.
Yes,
Yes.
after
Okay,
44
sorry, I
years
didn't.
of age, yes, ma'am. After 44 years of age, we have options like temporary work visa options, the visa for 82, that are available for those who have crossed 45 years of age. So they don't have to get disappointed. Still, there is a chance.
Exactly.
And
Maybe another question will be whether diploma nursing holders can apply for this. Yes, that also is there. That's why I just mentioned stream A, B, C. There are things out there. There are loopholes out there. There are pathways out there. You will get it.
All right. And Amy, a question.
CPT has.
So go ahead.
Yes,
Okay.
yes. Shruti DC has asked all these benefits applicable for both work visa and PR. The benefits which you have explained to me. So she's asking whether it is applicable to the work visa and PR.
Sure. And the question I had to either of you, the Australians, is whether, yeah, I think Amy, you just mentioned the diploma nurses, they can also get licensed. Do you want to talk a little bit more about it, one of you?
Maybe I'll throw that to Neethu. Neethu, are you happy to just explain that?
Yes. For a diploma nurse to come to the Australia, the option is they have to upgrade their qualification to BSc level. For that, they can do a short-term course of 6 months, which is graduate certificate in Australian nursing practice. Once they do that, they will be equalizing their qualification to the BSc degree level. Thereafter, they can go through the same APRA registration process that we have discussed. Previously, it was not like that, but now they have, mostly the GNM diploma holders from the UK or any other country, English-speaking countries used to migrate to Australia. But now, after this March 2020, APRA has changed into OBA process. So once they equalize their degree to the BSc degree, they have to do the OBA outcome process, outcome-based assessment. So they have to register with APRA, then give the portfolio creation. Once its outcome is out, they have to give NCLEX exam, then give OSCE exam, then they can apply for registration. So that is a pathway. Of course, they can do, but after doing GCAN program.
Great.
Thank you, Neethu. Yeah, that question is, it is every students have that question because we have really a good amount of students, those who completed their diploma nursing. Yes, of course, they can do it. This is based on your, when you completed your diploma nursing, it is your AQF, that is the Australian qualification framework. They will just look into that, and it is just coming only less than 7 when you are just calculating that. So that's why that they have to take another one online exam or course like, then they can just come to that eligibility criteria to meet that AQF or Australian qualification framework, that standard, then you are eligible to put your application for APRA. So yeah, that's
Then
the best way to do.
Yes. Then if you have more than 10 years of experience after your GNM diploma, you can equalize it and give the exam and you can get registered. So there are that are the two options. Either you should have 10 years of experience after your GNM diploma, or if your experience is below 10 years, you have to do a GCAN program to equalize it with the degree program. And the question which is asked by Shruti, when you are on a work visa, you have limited, you can avail limited services. You will have healthcare benefits, but you won't be getting childcare allowances. So it's partial benefits you can avail, not the complete benefits of a permanent resident while you are on a work visa. But definitely, if you are on a work visa, after 2 years, you are going to get permanent residency if you are fulfilling other criteria.
All right.
So
Beautiful.
I think, so it's a time to discuss the visa options which nurses have in Australia, isn't it?
That's right. I think that's something everyone want to know. Okay, what
Yes.
after all these things, right? Yeah, what after all these things?
Yes.
Absolutely. Yeah, let's go ahead with it, Neethu.
So, after successfully completing the registration, we have many visa options to come to Australia. So the first option is a temporary skill shortage visa. It is called subclass 482. It requires a sponsorship by an employer. and its duration is 4 years. And it is not a permanent visa, but while you are being in this visa, you can apply for permanent residency if you are meeting the requirements, the point requirements, or you can put a expression of interest. And if you are getting invited, you can apply for a 180 or 189 or 190 visa. Or sometimes once you work with this particular employer, after a particular point of time, maybe 2 years or 1 year, this employer itself can give you a nominated visa, that is 186 visa. So this is the first visa option, temporary skill shortage visa. This visa processing, for this visa, the processing time is very less. So you can come within 1 or 2 months.
Great.
In nursing,
Okay.
for nurses. The other professionals, it may take some time.
All right. And
the other next visa is, can I have the next slide?
sure, yeah, I believe it's coming up. Are you able to see it, Neethu?
Yes.
Yeah.
Yes. This is a skilled independent visa. The subclass number is 189. So this is a completely point-based visa, and for the skilled workers who are not sponsored by an employer or a family member or nominated by state or territory government. It is a permanent visa. So to get this visa, our aim should be having more points in the point assessment system. So you can give, you can increase your points through your scores in the English language proficiency test. If you have more years of experience, you will be having more points. And if you are married and if you are unmarried, the points are different. And you can give NATI CCL exam to increase your points. Now NATI CCL Malayalam examinations are there. So if you are standing with less points, you can give that exam also to increase your points. So if you have enough points, you will be invited on 189 skilled independent visa. So this is an independent visa. You can settle anywhere in Australia. There is no
sorry,
restriction.
excuse me, Neethu. Can you explain what you just said? What was that exam you said? So you said something, and can you explain that?
NATI CCL examination, that is a language examination which adds point to this, which adds points to the migration point systems, just like OET, IELTS.
Oh, okay, that's another language exam. Okay, that can still build up more points. Got it. Okay.
That adds point to the
okay, got it. Sure.
our point system.
Oh,
Yes.
okay, great. Okay, thank you.
So that's about 189 visa. Next is 186 visa. That is employer nomination scheme visa. I was on this visa 186. So when there is a shortage, the employer will sponsor some skilled workers. It is a permanent residency visa. You need to work for that particular employer for a specific period of time. That is the specific requirement of this visa. You cannot leave that employer within that specified time. After that, you are free to settle anywhere in Australia. You don't have to stay with them, stay with that particular employer. After that notification in that particular time period is over, you can settle anywhere in Australia.
All right. And anything else, Neethu, with the visa part?
Yes, one more visa is there.
Sure. Okay, here we go.
Yes. Regional Sponsored Migration Scheme Visa, subclass 187. This visa is for skilled workers who want to work in regional Australia. Requires a job offer from employer in regional Australia, and it is a permanent residency visa. So the clauses with this visa, you will be able to work in that particular regional area only. After a specified time, you are free to move to any other parts of the Australia. So these are the major visas the nurses can apply for.
Okay, great. Okay, now we have a whole plan. Now we just need to get started and move forward, right? Okay. All right. So what else, Amy? Want to add something that we need to complete before we go into the Q&A?
Regarding the regional visa, just to explain one point, regional, when you hear that word, you may think that, oh, I have to go to the outer area to live and to just stay there or work there. But from the city in Queensland, after 18 kilometers, that radius, after that area is considered as the regional area to get the visa. So from the city, if it is 18 kilometers away from that city, it is considered as the regional area for the purpose of visa processing. So that is actually assuring thing that to know.
Great. Okay, look like we could go over pretty much everything we meant to go over in this short period of time. And I think we could manage to answer most of the questions that came up in between. And is there anything else we should speak for the next few minutes before we wind up the session?
Yes, when we do ANMAC assessment, they need our experience certificate in a particular format. Sometimes what happens, we will be working there a long years back, and we have got one experience certificate from there, but that not be in particular layout in which the ANMAC wanted. So they have a particular model for their experience certificate. So it is better to get your experience certificate in that format so that your ANMAC process will not get delayed. Otherwise, they will demand the experience certificate in that particular format. You need to again go to the employer and request for an experience certificate, and it is going to take a lot of time. So just understand in their website, it is clearly given. So you can just go and download a copy of that and make your experience certificates in that format so that when you apply for ANMAC assessment, you won't waste your time.
All right. That's clear. And yeah.
There is a question to you, Anil.
Yes.
When are you, DiCarmel's international team, starting the training?
Can you clarify that once more, Amy?
When are you, the DiCarmel international team, start the training?
Okay, got it. Okay. I believe the person is asking, okay, so I believe it's referring to the NCLEX review. If I'm not wrong, yeah, the NCLEX review, it happens, we do have a rolling curriculum. We do have a rolling curriculum pattern, means you can enroll in the class anytime. I mean, that's needed because sometimes people contact me, oh, I want to take my exam next month, in 2 months. Oh, I missed it. I'm so disappointed. I want to retake the next 2 months and so on. So I don't want to discourage them and keep waiting them for weeks or months. You do have an open enrollment system. You go to website. Yes, now we have everything standardized. You go to website, you choose the program of your choice based on where you stand. And you'll be able to get started in a day from the enrollment. You'll have a one-to-one session before you come to the group. So basically, you can enroll in the class pretty much any time or every single week. You can, in any single week, you can get that done. Hope I answered your question.
Thank you, Anil.
You're welcome. All right, and
I think that's all the questions.
All right, wonderful. So that was an amazing time. We could, I mean, I myself back on my life after a couple of years, I believe. Now here, I'm back with more people, a lot of experts here to make our project, our service, a lot more effective and efficient. I believe we are experts in what we do. And when we do it together, its effect is a lot more. And moreover, what we believe, DiCarmel believes in transparency, fairness. We never trap anyone. We never cheat anyone. We let you know exactly what is from day one until you achieve your goals. If something we can't do, we let you know, no, we can't, sorry. And we won't disappoint you. We'll let you a clear instruction, clear information right from the beginning until you get through every single step of your process, whether it's for NCLEX or for your AFRA registration, whether it's US registration, your license transfer, or NCLEX review, whatever it is, or the OSCE, which is going to start at the very soon. So we'll have everything in one single roof. It's a one-stop solution for all your NCLEX needs for US, Canada, or Australia. Yeah, we can assist with your licensing for Canada as well, but this session was primarily focusing on US and Australia. So thanks everyone for coming on this session. This is just a beginning. It's not the end. We're just getting started. We'll have a lot more future sessions, and the sessions will be announced in advance, so you'll have time to plan for this event in advance. And to get more information and to get enrolled. Now, some of you already have passed your NCLEX RN exam. Now, definitely contact us. We can help you through the rest of the process. Maybe you have your US NCLEX, you want to get into AFRA process. Yes, we can help you with the AFRA registration, and it gets moving into OSCE and OSCE training and into your licensing part in Australia and helping you find the suitable employment. And so as for the US, if you're someone qualified, contact us. And yeah, with the US, as you might know, there are immigration limitations and regulation issues. I mean, the two options, you can come to the US are either through green card. You might know, most of you know, green card, there's a significant waiting time. It's more than 10 years, unfortunately, at this time, which might change. Hope that will happen sometime soon. And also H-1B is an option. While it also may have its own stipulations, it is not impossible. If you're fully qualified, if you have the right experience, you might be able to apply for H-1B as well. And you have connected employees who can assist you with the process as well, and which will be providing service free, of course. We don't charge anyone for any of the services. For the recruitment part, everything is based on the employment requirement. That's what we'll be doing. All right. So hope everyone enjoyed this session and benefit from this session, and you'll be utilizing these opportunities to reach your dream destination of US, Australia, or Canada. And we are waiting or looking forward to work with you to help you through this process and reach your dream destination at the earliest. Thank you so much, Amy and Neethu, for joining me the session and to make this event a wonderful session, helping many people, informing so many people what are these things and how we can do it. And thanks everyone again for watching, joining for a session from wherever you are, from all across the globe, to get to know what these things are and to get into your dream career in your dreamland. And we're going to end the session at this time. See you back sometime soon.